One very strange facet about the OR is the use of masks. In fact, I'm working tomorrow, which is Saturday morning, and I think I'll wear this mask to the OR. There really aren't that many people around on Saturdays, and I think these jingling bells are pretty much sterile, so it shouldn't be a problem. But anyways, wearing masks can be weird at first, especially if you're new to the OR. Your first experience might be falling unconscious because you've hyperventilated, breathed too much CO2, perhaps not had a full breakfast, locked your knees, all the type of things that can happen when you're a groomsman or a bridesmaid at a wedding. Although a bridesmaid dressed in the OR would probably be a poor idea. So anyways, one thing you have to notice is that you won't be able to communicate as effectively. You have to look at people as you speak. You need to talk a little bit louder because even the thinnest mask will muffle some speaking, lip reading, and it also makes non-verbal cues a little bit more difficult. Now after time, you'll be able to understand what a stare or an upraised eyebrow or something like that means. Sometimes it can mean this medical student is taking too long to suture the skin. It can mean you're incompetent, or non-verbal cues that you would normally make without a mask. After a while, even with a mask on, you can quickly interpret a look, but it does take time. So try to be clear in your communication and pay attention to your body language as well as what you say, because your body language, especially in the OR where we have a little bit less to go on to communicate, it does convey a lot. Now, for the type of mask you should wear, I've always been partial to the gray ones. The type that nothing can pass through. The type that you might wear 2 or 3 of them if someone with tuberculosis comes in, or if someone's getting something lasered off. Those are one of my favorites, but you can't breathe real well. So the yellow isolation masks, those are top priority if you just want to be able to breathe like a normal person and you're not quite used to having your face covered all day. Another advantage of a mask, again this is sort of the opposite of an OR mask since they cover from here down, is sometimes you get people who are OR pretty. Perhaps they have a bigger chin or a longer nose, so they may look very attractive, of either gender, very attractive with the OR mask on. If you're one of these people, you found your calling. As long as you take good care of your eyes, maybe your eyebrows, your forehead. No one will ever know if you're bald. It's a pretty good gig, really. Alright, so I might make a few minor changes, but I think I'm ready for the OR tomorrow with this mask.